I'm here at GS1 Connect for 2012. I'm here with Mike Innes, and we're going to talk about healthcare, EDI, GS1, the standards, implementations, and I think I've said everything I know about you, about what you're going to talk about.
Fantastic. So, as I mentioned, Kaiser's been on this journey to adopt to GS1 standards for about 18 months now.
Okay.
And we think that standards are critical to not only our basic supply chain processes, but addressing a lot of issues that face healthcare today. So, healthcare as a whole has double-digit growth on cost curves.
Right.
They also have diminishing Medicare and Medicaid reimbursements, so top line is getting affected. We also see a lot of things coming out of the recent healthcare reform legislation, like accountable care organizations, which basically link our reimbursement rates to proof that care that we're delivering is providing a certain level of outcome.
Okay.
So Kaiser really wants to take the data that's inherent into a basic supply chain process and add more value to it. Okay. Deliver it down to the point of care so our clinicians can use it, and it has a life beyond what's currently being looked at today.
So there are challenges in just bringing that data in, obviously standardizing it prior to receiving the data, and then the systems that handle that. What kind of challenges are you seeing with those internal systems?
So internally within Kaiser, there are a lot of business processes which support the clinical side.
Okay.
So we often see there is a need to, first of all, understand the different systems. There are scheduling systems for our patient rooms.
Okay.
There are revenue systems. There are patient record systems. And at the end of it, there's also basic ERP, which handles our procure to pay, our basic business functions. So one of the big challenges we had was, A, understanding what processes, what systems support what processes, and then taking that and understanding how do we move the data, the GTIN, the GLM, those components of GS1, into our system and have it feed into the various other pieces that are so integral to making our operation work.
So, and Kaiser Permanente is a single organization, but I have to imagine that there are multiple systems even within the same discipline.
Yeah, Kaiser's Permanente is the largest, they call it Integrated Delivery Network, or IDN, in the nation. So it has over 8 million members that we service, revenues in excess of $60 billion. So it's made up of about 36 unique hospitals and over 500 medical office buildings, and a various number of office and back office type support functions as well. So inherent to each one of those businesses, they may have just a slightly unique different system or configuration, which makes pushing a standard out from a centralized location a challenge, but we are working on it. And I think the value proposition that we have is really the need for this standard.
In general, are you approaching this from a systems point of view in replacing systems, modifying? Are you going toward a common standard set of applications? And kind of following on that, are you looking at systems like SaaS or cloud-based that give you kind of a central overview of, central repository and that kind of thing?
Yeah. So we are looking at cloud-based applications, and we also chose to support GS1 standards because the fact that their infrastructure was also partially cloud-based.
Okay.
We saw that as being able to leverage some of our current application and also the general movement towards a cloud-based environment.
Okay. That's obviously not a short-term proposition.
No. And it has to demonstrate a specific ROI as well as not disrupt operations.
Is there one specific point that you're driving to at the moment? Is there one main objective of a project overall?
So the strongest value proposition we have had, we started with a typical inventory ROI that we felt a GS1 standard could provide. That's generally accepted, but when we got into the clinical world and addressed some of the problems that our clinician had with simply scanning an item, something that you take for granted in the grocery store every day, right? And all the clinicians had either gone to the store the day before or the night of, and they are wondering why, as a supply chain organization, we can't provide an environment and a capability to have that ease of scanning.
Sure.
There's multiple barcodes on a package. And if they are lucky enough to, say, scan the right one, will the data be synchronized in our item master to pull all the relevant information, descriptions, unit of measure, price, all of which populate the health record.
Right.
We saw that GS1 provided the most value and had the most traction in the industry. And we also looked outside the industry. We like to take best practices in retail and consumer packaged goods and food services, grocery. And so all that being considered, that's the prominent standard that we are going to adopt and have been adopting, and really wrapping it in the context of facilitating barcoding.
Okay.
So we have started at the point of patient care and really driven our manufacturers to understand that they really need to put a GS1 standard barcode on a package to enable our clinicians to scan it. Then we have all the infrastructure behind it to support that, and we begin to come a step closer to the grocery store model, which is what I consider very efficient in that area.
Right, so down to unit level.
Yes.
Right.
Yeah.
Great. Well, you certainly have your work cut out for you.
I do.
That's a good thing.
Yeah, yeah.
Okay. Well, thanks a lot,
Great,
Michael.
thank you very much.
I appreciate your time.
Okay.
Great.
Fantastic.
Perfect.